now I'm really so pleased to introduce the initiator, instigator, the source of this, the reason for this, hearing, and again, just publicly say thank you to you, Congresswoman Frankel. This is an extraordinary amount of information that I think we have to digest, and I appreciate your efforts to bring it to everyone's attention. Congresswoman Lois Frankel.
But thank you, Madam Chair, for bringing this to us today. And Mr. Cole, I know is here. I know he's got a deep interest in this too. And thank you to the panel. Madam Chair, it's always something, usually it's something personal that usually brings something to people's attention. And in this case, it was very personal. I have there's 350,000 seniors who just live in my county that I represent. And one of them is very special to me. It's my 96-year-old mother, who I just want to tell you is, she's physically in good shape now, but she had a number of falls. And finally, the fourth one, she broke her leg. And I've seen how it dramatically has changed her life. She had superb medical care, but she was someone who was living independently before. She's very clear of mind. She still is clear of mind. She's now afraid to live by herself, uses a walker. And when I saw the medical expenses, I was shocked. Of course, she's on Medicare, but she also had some personal expenses, which is not really as relevant. But this is why I started looking into this, because all of a sudden my friends tell me, well, their parents all fell. And then my mother said, oh, all my friends have fallen. And then one of my friends fell and she broke her jaw. And then I fell and I broke my finger. I mean, I'm going like, is everybody falling? And the answer is, when you get to a certain age, yeah, a lot of people are falling. And I just want to say the $50 billion figure is the tip of the iceberg, folks, right? It is the tip of the iceberg, because it doesn't even include what Medicaid, for example, is going to expand if someone goes into a nursing home or into an assisted living facility. And there's so many other things. It doesn't even deal with what it affects the family and how you become a caretaker that you weren't a caretaker before. And we love our parents and so forth. I would do anything for my mother, but I want to tell you, it is like, she can't really do that anything on her own. And, getting the walker in and out of the car and it changes everybody's life in a lot of ways. And I saw someone who was very clear mind now, who we talk about nutrition and isolation and so forth, she's in an assisted living facility, how that affects her well-being and how she feels every day about herself. So, and then multiply this out, 33 million falls reported. Hello, what would you say? A lot more falls than are actually reported. And Madam Chair, I wanted to just let you know that I've made a request, actually myself and a number of members, because this is an Appropriations Committee, a number of requests to the committee to take a look at some of the falling shortfalls. And I wanted to discuss this with our guests. The Interagency Coordinating Committee on Health and Aging and Age-Friendly Communities has been authorized, but never funded. Could somebody, also the Research and Demonstration Evaluation Center for Aging Network, also authorized, but never funded. Could any of you please speak to the value of funding these programs?
So, Representative Frankel, yes, the problem is that what you're referring to is occurring at all levels. ACL Falls Prevention Competitive Grants have provided important seed money for local state organizations to reach out to a variety of partners and develop their own falls coalition, but those are not funded. So the sustainability and the effectiveness becomes extremely limited. Uh, the we have seen that reauthorizing uh, coalitions that actually have the funding to bring federal agencies that all have relevant resources and responsibility for falls would leverage the amount of funding that is available and would actually create the sustainability of cost-effective measures that can be happening at the local and regional levels. So what I'm saying is that uh, that this coordinating councils, these interagencies groups are effective. We've seen them in the Elder Justice Coalition. We've seen it in other areas, but they need to be funded, and that is basically the bottom line.
Madam Chair, I think I've run out of time, but if we have another round, I'll continue my questions on this area. Thank you, Madam Chair. Yield back.
Congresswoman Frankel.
Again, thank you all. I recently talked with folks from CDC and described what they thought were the four pillars on fall prevention: clinical care, make sure there's a fall prevention routine as part of clinical care, increase awareness among older adults and their caregivers, engage emergency responders, and address specific populations because they may have different needs. I think one of my colleagues brought that up before. So I want to see how I can get through this. But the clinical care, for example, you talked about a program called STEADY, evaluation. If you could tell me a little bit more about that, and do doctors get paid for this assessment?
Not right now. There is not a monetary incentive to really. We know that in the wellness visit is required to do a depression screening, but there is no requirement to really do a fall. Okay. They ask, have you fallen? But there is not a risk assessment of falls. That would be a huge step in the right direction.
Yeah, I agree with you on that. I'm just thinking of my own mother's journey, because before she had her really bad fall, she had another fall before where she had a wound. I mean, she was with a doctor, a primary care doctor, wound care. She had paramedics, all these touches. And I kept asking, like you, what can we do? And there was really no response other than, well, she's old, I guess, So is there any payment or any training for first responders in terms of, other than, okay, we have a patient here. Do they have to report? Do they have contacts? I mean, is there any program? I know there are some fire departments that do have programs, but is there any kind of national effort?
Yes, actually, Pinellas County, Pinellas Park County is doing a great job. And that actually came from the fact that it's very costly for fire departments to do those calls that are not reimbursed. So they decided that they were answering more false calls almost than fire calls. So the fire and falls became actually a dual issue for them. They are exemplary in terms of the education they give to the first responders, the resources they invest in community education, the partnership they have formed with the local falls coalition. And it's an excellent example of how resources from different sectors can come together and actually address a problem that affects everyone. So I think that the Pinellas Park County is a great example that could be replicated. Going back to the demonstration research of funds, I think one of the missing links is that we really don't have or don't invest enough resources in evaluating those efforts of those models, those innovations. This country has been built in innovation. So, but when we innovate, we need to evaluate and say, is the investment in this innovation going to actually be better in terms of cost effectiveness, in terms of quality? We are not at the point that we can actually do this demonstration nationwide and have everyone learn from it. So that's one of the reasons that we call so much, not only for the interagency coordinating body, but also the funding of demonstration projects that help us learn from those experiences.
And let me just emphasize that those are both authorized programs, not yet funded. And if I understand that
Yeah.
correctly. And the other point, well, I say I'm running out of time, but I would just say that educating older people gets difficult, especially as they may lose some of their ability to understand. You want to quickly comment on that?
Yes, there are really two sets of people, maybe three, but primarily those who are mentally able, but they really have to understand how their bodies have changed, how their environment is changed, and they need to understand how they can prevent falls. And the program Matter of Balance, the capable program. There's Tai Chi. There are a number of programs that do that very, very well. They're evidence-based, they've proven to be effective. But then there are programs for people with dementia or people who are unable themselves to learn how to avoid falls. Those programs are really targeting the caregivers, the family, the environments. Technology is helping actually a lot to help families create better caregiving for people with dementia, with a focus on avoiding falls. And we really need to learn from those and scale them and make them really nationwide movements.
Thank you so much. Thank you. I yield back, Madam Chair.